African traditional medicine and healing methods have existed for thousands of years in the continent's diverse cultures, developing long before the arrival of Europeans, though there is a lack of detailed documentation about this traditional knowledge. Stick to the end to learn how Africans treated illnesses like bites from poisonous creatures and even how they performed psychotherapy, various surgeries, and physical therapies. In traditional African belief systems, human beings consist of multiple aspects like physical, spiritual, moral, and social aspects. Optimal health is achieved when all these parts operate in harmony. On the other hand, imbalances in any of these aspects can lead to physical or even spiritual ailments. Therefore, an illness may be a spiritual, moral, or social disorder, and as a result, treating a person's illness involves not only addressing their physical well-being, but also attending to their spiritual aspect. In addition to this, illness is also perceived as a condition influenced by both natural and supernatural factors, leading to a holistic healthcare system consisting of three specialized levels: divination, spiritualism, and herbalism. One of the most prominent aspects of traditional African medicine involves the use of herbs, animal, and mineral substances for medicinal purposes. Different plants are believed to possess specific healing properties, and traditional healers, who are often referred to as herbalists or diviners, would gather, prepare, and administer these herbs in various forms such as teas, decoctions, poultices, or infusions. Additionally, medicines could be administered through herbal bathing, steam bathing, medically induced vomiting, nasal ingestion, enemas, and cuttings. In cases of food poisoning or bites from poisonous creatures, milk and a poultice made of charcoal called blackstone, in combination with ingesting activated charcoal, was used as an effective remedy. In steam bathing, a steaming mixture of herbs is both consumed and inhaled in the treatment of ailments such as fevers, while vomiting would be induced by emetics as a form of drug rehabilitation, which was used to treat alcoholism. Midwives also made extensive use of indigenous herbs to aid childbirth, while plants like the African daisy were used to prevent miscarriages. The African people have relied on these resources for various pharmacological activities which have been passed down through generations to maintain health and to prevent, diagnose, improve, or treat illnesses. Traditional healers undergo extensive training and apprenticeship to acquire knowledge about the properties of diverse plants, diagnostic techniques, and treatment procedures. The discovery of new remedies typically involves experimentation, observation of nature, and occasionally seeking spiritual guidance. They have successfully treated a range of diseases, including diarrhea, diabetes, pneumonia, dermatological problems, meningitis, arthritis, high blood pressure, dental problems, infertility, and allergies. Additionally, it has been claimed that these medicines can cure or at least relieve symptoms of diseases considered incurable, such as sickle cell anemia, schizophrenia, hepatitis B, psychiatric disorders, mental dementia, and senility. In various African societies, traditional healers perform surgical procedures such as circumcision, tooth extraction, or scarification for therapeutic or ritual purposes, employing tools and techniques passed down through generations. Presently, traditional healers in Nigeria continue to perform surgeries such as uvulectomy to address various throat problems. An account from the Edinburgh Medical Journal by Robert Felkin in 1879 reports a British medical student's experience during a missionary expedition to the Bunyoro Kingdom in Uganda, describing in detail a caesarean delivery. In this procedure, the woman was first anesthetized using banana alcohol, and specific iron spikes were used for edge sutures. Local anesthesia was commonly employed by physicians throughout Africa, with the Bantu region also using a beer containing extracts with anti-inflammatory properties for pain relief in patients with wounds, headaches, and migraines. Many ethnic groups conducted cataract eye surgery under local anesthesia by applying juices extracted from alkaloid plants directly into the eyes. Massage, manipulation, and bodywork techniques were also employed to promote circulation, relieve pain, and restore balance within the body. These may include techniques such as cupping, bone setting, scarification, or pressure point stimulation. While cupping therapy has been used for centuries in different cultures around the world, Africans devised their own cupping therapy techniques, employing animal horns along with herbal ointments and medications to treat conditions such as migraines, coughs, abscesses, respiratory disorders, digestive issues, common colds, and sore muscles. Spiritual concepts such as prayers, invocations, or incantations have also been offered in various belief systems to connect with mysterious and powerful forces to address the spiritual causes of illness. They involve practices such as exorcism, divination, libation, and animal sacrifice to treat various ailments. However, scientific validation and documentation of these practices remain challenging. During colonial era, ancestral medicine was often perceived as inferior, leading to its stigmatization. Traditional healers and their practices were also disregarded by the scientific community and mistakenly associated with witchcraft and black magic, and consequently deemed illegal by colonial authorities in many nations. As a result, the advancement of this aspect of African knowledge was restricted for a considerable period. However, in recent times, the modern world has shown increasing interest in certain medicinal plants used in African traditional healing systems, recognizing them as valuable resources for bioprospecting and the discovery of potential medications. Nevertheless, there remain many aspects within traditional African practices that could offer valuable insights to the modern world. The black stone is made by cleaning, drying, and baking the animal bone in limited supply of air, which gives it adsorption properties. To reuse it, the bone will be put in boiling water for some minutes, then soaked in milk for 2 hours to remove the poison. This technique has been used in different cultures across Africa, Asia, and South America. Thank you so much for watching, and we'll see you soon in our next video.